So I thought it would be interesting to just start this by having a very quick and dirty true or false quiz. So, and just two questions. So the first question is true or false. So on average, making reasonable adjustments in the workplace will cost an employer somewhere within the region of £1,200 per person. True or false? Takers?
Do you mean per person as in the person who's having the reasonable adjustments made for them?
Yes.
I suppose it depends on their disability. I'm going to go with a yes. Why not?
I'm going to go with false.
Yeah.
So it's false. So most reasonable adjustments cost nothing or very little indeed. There's on average some statistics show that about 4% of them do cost, and even then it's about £184 per person. So it's minimal. It really is quite small. The next true or false question. So 50% of people are born with their disability.
False, I'm going to say on that one.
False.
Yeah.
False, yeah.
Yes, so 17%, 83% of us will actually acquire our disability as we go through life. So it's quite an interesting statistic, I find. That's very interesting. So now I am going to attempt to share my screen. So there we go. So a little bit about Enham Trust. So Enham Trust, I know that you all know about Enham Trust, but Enham Trust is a disability charity based just outside of Andover. We support thousands of people on an annual basis to live, work and enjoy life, to fulfill their lives. And we do that primarily through 3 of our core streams. And let me unshare my screen there. So we do that through 3 of our core services. So they will be housing, care and employment. We also, if you don't know, operate some commercial businesses such as a charity shop and a cafe, as well as a factory, an information advice and guidance service, for example. The need for us to attract and retain and develop an inclusive workforce that reflects the communities that we work in is part of how we're made. It's part of our culture, and it has never been so important to us than it is now, really. We're proudly a disability confident leader. For those of you that don't know, I suspect that you all do, but for those of you that don't know, Disability Confident is a government scheme designed to encourage employers to recruit and retain disabled people and those with health conditions. It replaced the previous 2-tick positive employment scheme, if you are not aware. So some other statistics that I am going to share with you. So some key disability statistics. The one that's interesting for me is the WHO, so the World Health Organization's predicted that in 2020, depression will be the leading cause of disability. And I can see, I feel that, and I experience that with the people that we support and equally the networks that I have. That's definitely changed people's perceptions of disability, with a lot of people believing that it will be a physical disability. And as you will be well aware, depression is something you can't necessarily see. A few other statistics for you. So a disabled person is 60% more likely to have to make, is going to have to make 60% more applications for jobs to be successful. And interestingly, 1 in 5 employers have said that they would be less likely to employ a disabled person into their workforce, which again, I thought was quite interesting. Very interesting. So let me stop sharing that screen. So how has the topical news of the moment impacted us here at Enham Trust? So if we think back to, I don't know, January, February, like you, I was watching the news with my mouth open about this strange flu that was sort of spreading across the world, and really just thinking about whether or not it would impact us in the UK. I think at one point I didn't think it would come to the UK, but clearly it did. And then we're into March, and then organised companies are starting to collapse, like Flybe. The FTSE 100 is plunging. Confirmed cases were rising. The government action plan, we moved from one phase to the next. I think it was containment to delay. There was lots happening. Juliet and I were speaking earlier. Schools started closing. There was a lot happening. And I don't know about you, but my life became a bit like Groundhog Day. Boris's daily updates, the relentless amount of government guidance where you had to translate that into accessible information, government guidance, and manager's guidance, or you had to act on the guidance. Daily minuted meetings, decision logs, comms plans, monitoring absences. I could go on, and that was just repeated, wasn't it, day after day? And I think, interestingly, by that point, employment law hadn't and still hasn't in some areas caught up with what we're experiencing. So again, I don't know about you, but the decisions that are being made on a daily basis are based on judgment, risk, and really what we thought was the right thing to do. And we found, I'd be interested to know your views, that government guidance, when it was being issued, I learned quite quickly to delay any decision making for a couple of days until further guidance trickled out to support decision making, which was quite interesting. In all, we furloughed around 45 staff. A handful of those were asked to shield, so very few people were formally asked to shield by the government. We had very few people. We did have some people off with flu-like or cold symptoms. And working from home became the norm for about 40% of the workforce. And I know these statistics will differ from organisation to company to company. Interestingly, at Enham, we positively discriminate and recruit disabled people into our workforce, and we're proud to do that. And we do that through an access to work scheme. I know that some of you will be aware of those schemes. We receive funding to support, train, and develop people to enable them to move on into permanent employment. And a number of these individuals had to be furloughed, either through a loss of income in the area they work in, so a factory or a charity shop, or through social distancing or lockdown guidance. We needed to furlough a number of staff. And through that and through societal norms, we knew that well-being needed to be a priority for us, given that a number of our workforce have disability or a hidden disability, such as ill mental health. So I think what's interesting is if we think about that for a minute, for most of us, it was quite challenging to suddenly switch to a new way of living and working. So the rug's being pulled out from under us. If you don't have a disability, I'd like you to imagine for a moment that you do. So imagine you're on the spectrum, for example. Everything for you has to be exact. The way you live your life has to be exact, and you perhaps might not like change. And for some individuals that have a disability, Asperger's or another disability, they might not understand why those changes were being made. They needed to be made. And for those individuals, and for most of us, where home working was the norm or has become the norm, we all lost something very precious to us, and that's social and human interaction. I don't know about you, but that's something that I particularly struggled with. You don't get the same interaction through Teams or through Zoom. I'm looking forward to the moment that I can start randomly hugging people that I come across. It'll be quite nice. So what do we do at Enham? I'm sure, like yourselves, you've made loads of changes. So we actively encouraged our employees, regardless of their temporary employment status, i.e. furloughed, shielding, to join our Enham Facebook group, employee Facebook group. We shifted the focus in that group to wellbeing. So there's a great deal of emphasis on wellbeing and engagement. So daily activities, regular videos from our CEO or the senior management team. And we tailored our contact for those individuals that are furloughed and dependent upon their needs. And their needs might be email communication, WhatsApp messages, or phone calls, Zoom meetings. So it really is dependent, and we had to tailor it for their needs. We also upped the ante on our employee assistance program. We outsourced that program, but we upped the ante, and we have a member of our workforce who's a trained counsellor that offers her services to individuals that might need some extra support. We found it helped them to know the person, the counsellor that they were speaking to. That was particularly beneficial. We sent thank you cards to staff stuffed with sweets and to our volunteers. We've started to develop toolkits for managers on various subjects such as managing teams through a global pandemic, self-care. I think it can be quite hard to practice what you preach in terms of self-care, but it's particularly important for our management team through this period that they do it and that they encourage others to take care of themselves. And how to have virtual team meetings, for example, is another area. We've had to adapt how we train staff. Furloughed staff are undertaking training, and through the help of various stakeholders, we're rolling out training for managers in supporting their teams with mental health, which we're doing through the Astor Foundation, as well as rolling out mindfulness sessions for all staff, for all employees. So we've done lots, and we're continuing to learn and evolve as time progresses. I think, like many people at the start, we didn't know how long this would go on for. We didn't know how long people would be working from home. So we were following initially HSE guidance, and the minute we felt that it switched from short-term working from home to long-term working from home, we issued working from home checklists and DSE assessments for all staff to complete. And I think with our home workers, health and safety and their well-being was and still is our priority. And we shifted the focus to outputs, and importantly, the message to staff who are working from home is clear that it's take time out when you need it and work when you can to suit your lifestyle, because like many people, there are people juggling childcare, crazy dogs that eat your sofas, supporting somebody else, collecting medication, etc. There's so much that people are having to adapt to. And we've also developed a risk assessment for anyone attending the workplace, as well as for those staff that when we start opening up departments and areas of the business again, that we'll complete with them. And we've also developed a working safely guide for employees, including an easy read version, which is to not only help individuals understand what's important, but also to protect the organisation, to protect the charity. Like many organisations, we had to develop a Trustwide risk assessment, which we will be publishing, and finalising secure plans for various departments, such as our charity shop and our factory, when we begin to open up those again. So, and if you think back, interestingly, if you think back what I was saying earlier about people having the rug pulled out from under them, we're actually going to have to start doing that again for those people that perhaps have been furloughed and may have a disability that are just getting used to life as it is. We're going to be there again, pulling the rug from under them. So we're developing some guidance for managers to help them guide staff through that process. So I think in terms of what's next, the new flexible job retention scheme will consume all of our lives, I'm sure, over the coming days and weeks. And interestingly, during this week's management meeting, we had the following agenda item, which was the coronavirus has radically changed how we're working. And in essence, what I think that we have is a blank sheet of paper and an opportunity to get and be creative about what the future of Enham working at Enham looks like. So what does it feel and look like? So we've just started conversations. We don't have all of the answers. And I think it's a really great opportunity for us at Enham and for any organisation to start thinking about what normal looks like for them. And I feel on some level that it's a shame if organisations don't grab this opportunity to do that. And just finally, I have one slide that I wanted to share with you. If you're not already in touch with Enham Trust, I'd encourage you to think about the impact you can have, to the impact you can make to the lives of the disabled people that we support. So follow us if you're not already through our social media channels. You could sign up to receive our newsletter, sign up to our events. If you're not already a disability confident employer, talk to us about how you could be. And also encourage you as part of this networking group, whether or not we could mutually work together in a beneficial way. That's my presentation.
Thank you so much, Amy. That was wonderful.
Really interesting.
Really interesting.
Really
Right, I'm going to
interesting.
stop recording and then we'll go to some questions.